Alright, my name's Courtney Spees. I'll be doing a video on the urinary tract infection case study. So as soon as I enter the room, I note that Miss Phillips is in bed watching television with two side rails up. She does not have any drains or tubes. I see that she has a IV in her left arm. That IV is running with normal saline at 100 milliliters per hour, continuous infusion. I note that she does not have any obstacles to the bathroom or to any other exits, and that she has her call light within reach, and that she has her side table within reach. And her caregiver is in the room with us. Alrighty, so the first thing that I'm going to do is start her head-to-toe assessment. Can you give me your name and your birth date, please?
Anthony Phillips, December 28th, 1999.
Alright, and do you know where you are today?
Hospital.
Yes. Do you know what today's date is?
1949.
Okay. The first thing I'm going to do is wash my hands and put on some gloves. Alright, I'm going to ask you, can you please turn your head to the side for me? Alright, and then turn your head the other way. Okay, so I did not know any jugular vein distension. And then I'm going to go ahead and do Perla. Click. Click. Alright, her Perla was 3 millimeters. I'm going to go ahead and ask her if she can grab my hands. Okay, and then can you do push-pull for me? Push me. Yep, pull me. Alrighty, and then I'm going to go ahead and check her radial pulses. Her pulses are strong bilaterally. Okay, let's see. While we got you, go ahead and, while we're laying down, I'm going to go ahead and do your abdominal assessment. So, alright, so first thing we're going to do is inspect the abdomen area. I don't know anything. We're going to go ahead and listen. Alright, bowel sounds are active and present in all four quadrants. Do you feel any pain when I press here? What about here? How about now?
No.
How about now?
No.
Alright. The abdomen is soft, rounded, and non-tender. Okay, the next thing I'm going to ask you to do, can you go ahead and sit up for me, please? Alright. I'm going to listen to lung sounds. Have you been having a cough lately?
No.
Okay, every time my stethoscope touches you, I want you to take a deep breath in for me. Okay, same thing for the back. let's go ahead and raise your right arm for me, please. Take a deep breath in. All right, then can you raise your left arm? All right, and while I'm here, I'm going to go ahead and listen for her apical pulse. And while I'm listening, I count for 30 seconds and multiply by 2, or listen for a whole minute. And the apical pulse was 77. While you're here, I'm going to go ahead and check your skin turgor. Okay, it's elastic. All right, you can go ahead and lay down. And while I was checking her skin turgor, I noted that her skin was appropriate for her ethnicity. It was pink, it was warm, and it was dry. Before I start moving downwards, I'm going to go ahead and do your cap refill. Each finger. And the other hand. Alright, cap refill is less than 3 seconds on the upper extremities. Alright, now I'm going to ask you to push and pull for me. Alright, so her push and pull was weak bilaterally on her lower extremities. I'm going to go ahead and do cap refill on the toes now. Alright, and her cap refill was less than 3 seconds on her lower extremities. Are you having any pain or like tingling, numbness in your lower extremities?
No.
What about your upper extremities?
No.
If you could rate your pain right now, what would it be?
2.
Okay. One last thing. When you urinate, are you having any burning or like pain when you're urinating? Yes. Okay. Do you notice any discharge after you urinate?
Yes.
Yeah. Do you have like any increased frequency, like you go more than usual, or?
Yes.
Okay. Have you had any incontinence lately?
Yes.
Okay. So basically, what I would be doing now is doing my handoff report to the end of the nurse, or the nurse at the end of the shift. And so initially, Miss Phillips came in and was confused. She had an altered mental status and she had weakness. They just noticed it that morning at her nursing home. Her caregivers noticed that. The nurse inserted a bore IV and drew blood and completed a chemistry and a CBC. The provider was worried that she was having a stroke. Her vital signs initially were her heart rate was 122, her respirations were 24, her blood pressure was 92 over 58, her pulse ox was 92, and she had a temp of 103.6. The CT scans came back negative for intracranial bleed, and so he did not think that she was having a stroke. Afterwards, I was called into the room, and I realized the patient had become incontinent. I noticed that she had a foul, sour odor to her urine, and her blood pressure had dropped to 88 over 52. So I went ahead and did a 500 milliliter bolus of normal saline through her IV, and that trying to raise her blood pressure back to a therapeutic range. And then I obtained a urinalysis and a urine culture before I started the vancomycin, which was ordered 1,000 milligrams from her IV only one time, and that was stat. So I wanted to do the urinalysis and the urine culture before I started treatment so we could have a baseline to compare to once the treatment was in process, so that way we could tell whether the treatment was being therapeutic to her or not. When I got the urinalysis, I noted that the urine was cloudy and it had a foul smelling odor to it. And then after 3 days of treatment with the vancomycin, Miss Phillips is awake and oriented times 2 to 3. She has dementia, so she usually thinks that occasionally she thinks it's 1946, but she is calm and conversating with us, and now she's able to ambulate in the hallways. Whereas prior to she had weakness bilaterally to her lower extremities. So what I'd be doing for discharge teaching is I said I would increase the fluid intake to increase blood pressure and also flush out that urinary tract. I would educate the patient on how to wipe from front to back from the urethra to anus to prevent introduction of bacteria into her urethra, which can cause growth bacteria, introduction of bacteria, which can lead to UTI. I also noted that if the incontinence continues, I would ask the caregivers to implement a check and change schedule because bacteria love warm and more moist environments, and this will also aid in preventing skin breakdown. I would educate the patient on limiting the amount of sugary beverages to help decrease chances of another UTI because bacteria love sugar. And I'd also teach the caregivers the signs and symptoms of a UTI and educate on when to call the MD or nurse. So yeah, I think that's about it.